Welcome to Health Bulletin. Today we bring you the top global health updates making headlines. New cases of Murine Typhus in India, a Marburg virus outbreak in Rwanda, Mpox spreading in Kenya, and a surge in mosquito-borne diseases in Delhi. These stories reflect the evolving challenges of global public health and the urgent need for vigilance as new and old threats resurface. Let's start in India, where a 74-year-old man in Kerala has been diagnosed with Murine Typhus after returning from Cambodia. This is a flea-borne illness caused by the bacterium Rickettsia typhi. It spreads through fleas that typically infest rodents like rats. The patient reported severe body pains, fatigue, and loss of appetite, prompting doctors to conduct tests that revealed impaired liver and kidney function. While Murine Typhus is treatable with antibiotics as soon after symptoms begin, it can be serious if left unchecked, especially in the elderly. Meanwhile, Kerala's health officials have reassured the public that there is no risk of human-to-human transmission in this case. Still, with symptoms resembling other illnesses like fever, headaches, and a rash, accurate diagnosis remains critical. Now to Rwanda, where the Marburg virus is once again making headlines. The country has reported 3 new infections and 1 more death, bringing the total number of cases to 62, including 15 fatalities as of October 17th. This hemorrhagic fever, similar to Ebola, is highly contagious and deadly. Rwanda has launched an experimental vaccination campaign using a vaccine from the Sabin Vaccine Institute, with over more than 700 high-risk individuals already immunized. But the outbreak is still contained within a hospital cluster in Kigali, with 21 people under isolation and 26 patients having recovered so far. Will this experimental vaccine be the breakthrough needed, or will the world face another long battle with this deadly virus? Next, in Kenya, Mpox continues to spread, with 1 new case bringing the total to 10. Health officials are urging vigilance as the outbreak touches 9 counties across the country, from Nairobi to Kericho. Mpox, known for its painful rashes and flu-like symptoms, may not spread as easily as some viruses, but the Ministry of Health is taking no chances. To report any suspected case, Ministry have issued the emergency hotlines number. They've traced 68 contacts, most of whom have already completed their monitoring periods, with only 1 positive test during this time. The Ministry continues to screen travelers and monitor the situation closely. But as new cases emerge, the question remains: are countries like Kenya ready to handle this outbreak, or are we seeing the early signs of a larger crisis? And now to Delhi, where mosquito-borne diseases are surging. This year, the capital has seen 511 cases of malaria, the highest in the past 5 years during this period. While no deaths have been reported, the numbers are alarming. The city recorded 193 malaria cases in September alone, and 81 more in just the first week of October. But malaria isn't the only threat. Dengue cases have crossed 200 this year, with 3 fatalities so far. And chikungunya cases have tripled compared to last year. The Delhi government is ramping up efforts, intensifying testing, targeting hotspots, and promoting community awareness. The question is, will these measures be enough to contain the surge, or is Delhi facing an uphill battle against these age-old enemies? These are reminders that the world is still grappling with old and emerging health challenges. From the reappearance of Murine Typhus in Kerala to the deadly Marburg outbreak in Rwanda, the resurgence of Mpox in Kenya, and the rise in mosquito-borne diseases in Delhi, it's clear that our global health systems must stay one step ahead. But here's the critical question: are countries truly learning from the lessons of past pandemics, or are we continuing to react only when it's too late? As these outbreaks unfold, the world will need not just new vaccines and treatments, but also stronger surveillance, quicker responses, and a renewed commitment to global cooperation. Thank you for watching Health Bulletin. Be sure to subscribe for more updates on global health and science that shape our world.